Good morning, all. This is Manisha Saha presenting the today's topic role of physiotherapy in postural health of women. And I am really thankful to Movement Maestro Academy and Dr. Pradut to give me this opportunity. And let's start with the session. So let me share the screen first. So this is role of physiotherapy in postural health of women. So first of all, we know what is posture, right? Then the importance of posture in the main factor that affecting the women's health. So primarily the role of physiotherapist in that is to maintain the functional independence and physical performance, and also major role in preventing and managing pain. Obviously their physical impairments, their disability, their what are the limitations they are affecting in their activities of daily living. Also it play a very important role as a physiotherapist. So first of all, and also we can do promoting fitness, health and wellness. So overall the role of physiotherapist in preventing the postural analysis or disability is to assess the main effect of injury, then the disease and the disorder or movement and function, and also have the skill. The physiotherapists have the skills to provide comprehensive treatment plan to help restore or enhance the function. So this is the overall idea we can get what the role of physiotherapy in mainly the postural health of women. Postural health of women, so male and female are different ratio, the different ergonomical activities and different functions, physical functions. So they have their all different postural analysis according to them. So first of all, we can give a brief idea about what is posture. So posture is usually defined as relative arrangements of the parts of the body. Relative arrangements of the part of the body means the arrangements, the what is the head, posture of the head or neck or shoulder, the correct alignment, the center of gravity, the base of support, all we can put together, the line of gravity. So it can relative arrangement, the relative arrangement of all of the body parts in a different way or in a certain way, that is called a perfect posture. So what is a good posture and what is a poor posture? The good posture is the structural alignment, the muscular and skeletal balance, which can protect our structures. Structures means our when we are sitting or when we are standing, the structure is responsible for that particular posture. So in that posture, like it may be lying or it may be squatting or it may be stooping or it may be sitting or squatting, whatever the position is, the structural and skeletal balance supporting the structure body against injury or any progressive deformity, whether it is lying or whether it is in any posture or working, that depends the what muscle is working on that and what muscle is relaxing or what muscle is mainly perform that functions. So that optimum position, that correct position, the balance of muscular and skeletal balance for perform an action, that is called a good posture. And then what is poor posture? That is a faulty relationship of the various parts of the body that produces increased strain on the supporting structures and which there is less efficient balance of the body over its base of support. So all you can know is what is the center of gravity, base of support, line of gravity. So poor posture, good posture is what? It is the relative arrangements of the part of the body on structural and skeletal and muscular balance. But the poor posture is the faulty relationship, but the line of gravity is not in correct alignment, and that produces a unnecessary strain to the muscles or supporting structures, which is obviously less efficient to perform their activity or to balance the body. So that create a poor posture. So posture can also be regarded as the alignment of the musculoskeletal system in such a way that the body moves and functions this with maximum efficiency. Using this description, posture alignment can be evaluated in terms of, so it can be further divided into various terms. So posture can is the mainly muscular and skeletal, means it is musculoskeletal system in such a way that whether the body moves, whether the body in rest. So the maximum effort or maximum credibility to the muscles that perform an activity or muscular efficiency, maximum efficiency the muscle or skeletal system can put to that work, that consider as a postural, good postural alignment for a function. So what are the postural alignment in terms of, we can see later. Then this is the postural standards, that is the excellent, good, poor or bad. In excellent posture, the head should be up, chin and chest is up, breastbone is part of forward, chest is forward and the lower abdomen in straight and the back should be curved with a normal alignment. So that is the excellent posture. Then what is good posture is head slightly forward, chest slightly lowered and lower abdomen is but not in stress, and then back curve slightly increase. That is a good posture. And what is poor posture? The head is forward, then chest is fixed and the abdomen relaxed and the back curves is exaggerated. That is called poor posture. And what is bad posture? Bad posture is head is in the forehead forward is increased, chest depressed, abdomen is completely relaxed and protruded, and then back curves is obviously exaggerated excessively. So that is called a bad posture. So this is in standing posture, what is good or bad, and what is the correct posture of sitting, how we can sit in a maximum time for a correct posture in sitting. So what the eye is must top on the screen should be on eye level. The computer screen is on eye level. If the then the chair should be completely support your thighs and then leg is must in rest, that is 90 to 180-degree angle. Then your feet should be flat on the floor. Then make sure you relax your shoulders and your forearms should be parallel to the bar or floor, that is the table that should be supported, and the chair should have a backrest that supports your lower back. So this is the ideal posture for sitting. We can here. So what are the terms we can describe in a good posture? The first, the muscle balance, the joint position, static posture and dynamic posture. So what the muscle balance? Muscle balance in between the length and strength of the muscle working over a joint. The length, what is the length of the muscle and what is the bulk of the strength of the muscle working over a joint, that determine the muscle balance in a good posture. So the posture is maintained well by the movement or by the any activity. So joint position is the proper alignment of the body so that we can maintain our good posture. So what is static posture? The musculoskeletal positioning at any position of rest. So whether we are lying or whether we are resting, so the alignment, the body alignment should be proper so that the posture should be maintained for long term. Then dynamic posture, the postural alignment maintained during movement. So whether we are awake, walking, whether we are in activity, doing our daily life, so the posture should be maintained in that terms. So that is called dynamic posture. So posture is long an important and vital part of physiotherapy assessment, also for treatment. So we have to assess properly and according to that we can plan the treatment so that the good posture we can achieve for that patient or for that individual. So the assessment, postural assessment is considered three essential components. First, the examination of body alignment in standing, then test for joints flexibility and muscle length, and last the test for muscle strength. So these are the three essential components you can assess to a patient for their to assess the perfect posture or for any treatment protocol. Then examination is standing includes static and dynamic posture and the assessment of bony architecture and alignment of the upper and lower quadrant for deviation from ideal posture. So we have to divide upper and lower quadrant for correct posture and for correct alignment. So to identify the different abnormal postural patterns such as kyphosis, so there are different types of postural deformities we can find, that may be kyphosis, lordosis, sway back, military, and flat back posture. In that, the postural alignment, that is a type of abnormal posture, so we can assess them and treat them according to that. So as per the spine is particular, so in that we can scoliosis, pelvic may demonstrate excessive anterior postural oblique tilt. So these are the most common deformities, postural deformities we can have. And the common postural abnormalities are also when divided according to the upper quadrant and lower quadrant. So in upper quadrant, the head mainly play an important head protruded forward, and the changes in the scapular and glenohumeral position, also the chest and uh, spine position. And the common postural problems detected in lower quadrants are the hip play and main important role. Hip may be rotated anteversal or retroversal, and knee genuvalgum or genuvarus, and also tibia torsion and foot alignment, malalignment. So it play a very important role in lower quadrant, hip, the knee, and tibia or foot. So that the treatment protocol decided by the physiotherapist are based on a subjective and objective musculoskeletal assessment. So first we can take the history, then come for subjective and objective musculoskeletal assessment. In that we address the problem, and according to that we can treat the postural education, re-education, and in that we can help the patient to achieve their highest level of physical function. So now we can concern more about the women age group. So what are the changes occurs in women age group according to their age difference? So first we can know about adolescence, then pregnancy, then later on menopause. So in adolescence, the age between 14 to 25 years, what are the changes occurs in women's body in that time? So adolescence is the period in which the rapid bone growth is occur. There is lot of changes, hormonal changes, and the structural changes occurs in adolescence age. So the bone mass, also the structure of muscles, exercises, that plays a very important role in adolescence. So girls are in that time, girls are more prone to mechanical and societal influence, so that it can change the postural alignment, and it have the more chance to develop poor postural habits in that time. So those are the factors responsible for the poor posture in adolescent ages. Mainly the movement, they are more sophisticated in that time. Then the kyphosis is more protruding head position, then loss of shoulder range, slouched position, ill-fitting school dress, and overloaded bags and backpacks. So these are the plays an important role in deteriorating the postural alignment of the adolescent girl. So the most common spinal deformity in adolescence is idiopathic structural scoliosis, which is best detected prior to menarche for optimum treatment outcomes. So what are the changes occurs in adult, that is in between 25 to 45 year? So in that age, mean the structural growth is no longer influenced anymore, and that it more influence the activities of daily living, like lifestyle, their lifestyle mainly occupational and sports activity, any sports activity, and their physical work in home or in workplace. So it may affect more to their postural alignment, and that leads to more injury in women. So in occupation, they require prolonged static position and heavy, if there is heavy manual work or any shift work, or there are any repetitive activities they are doing, that more they have the, that's why they have the more risk or high risk for any injury, or that leads to postural imbalance and that adopt a certain posture, so that resultant may be the the result is mainly for muscle injury or muscle pain or any deformities. So there are also many sociological and medical factors that affect the posture change for this age group. So the social expectation in that time to women, of course, is caregiving, financial stress, any abuse that may be physical or that may be sexual, or any high risk social behaviors, or except drinking, drug use, the many all can contribute to a posture that compromise their normal postural health, that compromise their joint positions, that compromise their muscle balance, and also the movement patterns. So these years are an optimal time for a woman to develop and maintain healthy postural and exercise habits before entering the middle and elder years, where postural changes may become more structural. So this is the more important time for any woman to maintain their healthy postural habits and exercises to give a good posture to their body. So the most important phase of a woman's life is obviously pregnancy. So in pregnancy, there is a wide range of postural and physical adaptation to the hormonal changes are there, musculoskeletal changes are there, circulatory changes are there, metabolic changes are there. So these are the wide range of changes happening to a woman. They are experienced in pregnancy. So the whole system is compromised in pregnancy during of a woman. So the physiological adaptation include a profound increase in body mass, retention of fluids, laxity in supporting structures. So these are the play a very important role to change a good postural, to change the physiological adaptation to a physiological changes that contain alteration in the loading and alignment of muscles forces along the vertebral column and the weight bearing joint. So it can put a more pressure to a woman's health or woman's musculoskeletal structure, respiratory structure. So it hamper more the posture badly to the women. So research found that postural adaptation typically attributed to pregnancy, such as forward shift in the center of gravity followed by a anterior pelvic tilt and subsequent increase in lumbar lordosis and thoracic kyphosis that occurs in a pregnancy generally. So back and pelvic pain are a well recognized problem affecting many women during pregnancy. So this is the main factor of postural adaptation to a woman. So pre-pregnancy postural habits tend to exaggerate during pregnancy. So there is laxity of structures supporting tissues. So it enhances by releasing the relaxing hormone and becomes greater in the direction of habitual posture. So during the term of their pregnancy, most women adapt to these postural and physiological changes and following the baby's delivery and return to their pre-pregnant state. So in pregnancy, what happens? The whole structure can compromise, whole body structure can compromise to, and also the postural adaptation, different types of postural alignment, the laxity of structure, the muscle structure, the joint position, also that can affect in pregnancy. So it can easily redirected to a bad posture in that time. So we have to maintain proper alignment in that time, like a good posture, and maintain our healthy diet and also the exercises habits to return to a maintain a healthy posture. So last is menopause, and it the age in between 45 to 65 years. So in that time the body is in degeneration position. So what happened in that time? The musculoskeletal system, the physiological system, and all the systems affecting women in that time, and it also play a significant role, an essential role to deteriorate our bone and muscle health. So there is reduction of muscle strength, there is decrease in endurance. It leads due to types of muscle fiber which contribute to decrease exercise endurance. So that play a very important role, shortening of soft tissues that leads to faulty posture automatically, and that exaggerate the poor postural habits. And also in that age, the women are high risk of developing osteoporosis due to the hormonal changes and due to the compression of uh, also there. That's why they are lead to compression fractures, vertebral compression fractures, or osteoporosis can directly lead to the fractures. So the fractures associated with pain, exaggerated and age-related postural changes, including thoracic kyphosis, then head and neck protrusion, reduced lumbar neurosis, and loss of height. So these are the factors that influence the bad posture or faulty posture in the age of menopause. So this is the postural alignment. What is the correct posture? What is the low back? What is the flat pelvis? What is the slumping posture? What is the military posture? And what is the round shoulder? So these are the different types of postural deformities or postural abnormalities we can see in our day-to-day life. So what is the role of physiotherapy in women's health, particularly in for posture in an overall? So physiotherapy plays a very important role in assessing and treating postural alignment and associated dysfunction. So what are the dysfunction the associated with the posture? In that, physiotherapists play a very important role to maintain their posture and also treat them. So it focuses on improving or maintain the muscle functions, joints function, and soft tissue, and it also reduce the pain and improve movement. And the physiotherapy correct the posture mainly focus on increasing the muscle strength that leads to help the musculoskeletal balance, and that correct the postural muscles and stress on the muscle so that it can reduce the stress and automatically they easy to do their activities of daily living. So in the next, physiotherapist can provide also pain relief and rehabilitation, allowing the individuals to regain their natural posture. So what is the natural posture? Natural alignment, central gravity, the line of gravity, the basic support that we can teach properly. And the treatment part is mainly for treating the new posture rather than to enable the posture, re-educating about the importance of changing the posture periodically throughout the day. So mainly the physiotherapist can focus on the good posture, not to comfortable posture of the patient. So they re-educate the patient for their to maintain their healthy living and to maintain their muscle function and to reduce the pain and improve the movement. So what are the objectives of postural correction? Mainly to implement perfect postural habits, then maintain the normal range of motion for their joints, then achieve a standard range of nerve extension and achieve appropriate muscle length, then improve muscle endurance and obtain a good level of muscle strength and develop a good sense of spatial awareness. So these are the objectives we can have to correct the proper good posture. So what are the treatment approaches for postural correction? So first, postural and movement retraining. So what is the good posture? What is the in resting? What is the good posture in sitting? What is the good posture in supine lying? What is the good posture in walking? So we have to train them. We have to train accordingly so that they can know the actual posture and we re-educate the patient for their activities of daily living. Then second, preventive or assistive tapping techniques. So whatever the due to faulty posture, what happens sometimes they are more prone to injury. So it to prevent that injury you have certain techniques like tapping techniques to avoid that injury, so we can prevent that for further damage to that joint, so we can prevent that. Then joint and soft tissue stretching and mobility exercises. So for to treat the disability we can do the stretching and mobility exercises to for the flexibility of exercises. Then supportive bracing. The bracing is also required for the prevention of the further injury. Then targeted joint and soft tissue manual techniques. So there are so many manual techniques you can use to for that particular joint or particular area to treat that part and to enhance the good posture. Then corrective exercises to increase strength and flexibility. So the main goal is to increase strength so that they can compensate with their loss of muscle balance and easily do their exercises and properly maintain their good postural habits. Then proper education and training is required about posture so that they can understand what is the importance in posture in their day-to-day life and increasing the range of motion. So increasing the range of motion into the what then the strength is muscle strength is increased, the automatically the flexibility and manual techniques are mostly play an important role to increase the range of motion. So mainly the patient should understand what is the role of physiotherapy is to understand the patient, to re-educate the patient and to re-educate the patient about the posture. So whatever the posture is, posture is will play a very important role in standing or in sitting, whatever they are working, whatever the posture may be. So it should be proper. So due to that, what happens in poor posture is they are prone to more diseases, so disabilities and more injury. The muscle strength or muscle balance or musculoskeletal balance is hampered in that faulty posture. So patient need to understand that, or all individuals need to understand that and maintain their good posture so that they can prevent any disease and maintain a healthy diet and healthy exercises habits so they can prevent any disabilities or any deformities or any injury in further. So that's it for today. Thank you.